bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Hi, everybody. Welcome to Comcast Newsmakers. I'm Tony Hill. We're here in Annapolis during General Session, and of course, there's an awful lot that takes place here. Lots and lots of bills that are introduced, some that get passed, and some that aren't as fortunate. We're going to talk about some of those to try and keep you abreast of what's going on with Roger Manno, who's delegate from District 19.
It's an honor to be here and serve the folks in the 19th District, and I appreciate very much that honor. My focus this session is healthcare, public safety, and really consumer protection to address the problem of assaults on police officers and first responders. Current law allows for an extended penalty for assaults against police officers. However, it does not apply to first responders. So this legislation would increase the maximum penalty for an assault against a police officer and expand the scope of the current law to include first responders, firefighters, EMTs. Many times these folks are on the scene before the police officers. They're going through doors, trying to save lives, and we need to do all that we can to protect them while they're in the line of duty. So that's the thrust of HB 24.
You want to make sure that there's no discrimination when it comes to long-term care.
One of the glaring problems that we have in the healthcare system in Maryland is a provision that allows for discrimination against individuals based on their genetic information. Insurance companies to which you are applying cannot collect genetic data, they cannot screen genetic data, they cannot use genetic data where they're making a determination as to whether they're going to underwrite that policy or not. Many individuals who have the markers for certain traits, sickle cell and heart disease, sickle cell, just because you have the marker for that genetic trait does not mean that it will or it has manifested itself into a pre-existing condition. That's unfair, it unfairly discriminates, and it has a chilling effect on people actually taking those tests for fear of it being used against them.
Sure. We also want to talk about safety in terms of workers on the job, making sure that they get their shift breaks. I understand it's not really a law.
You know, when we brought this bill up last year, the meal breaks bill in the Economic Matters Committee, workers who work up to 5 or 6 hours should be given a 15-minute break, up to 8-hour shift, a 30-minute break. There is a direct correlation between the numbers of workers' comp claims, which rise proportionally to the length of time that those workers work without taking a break.
Sure.
This bill will mandate that every worker not under a collective bargaining agreement in the state be given adequate shift breaks. It's probably the most sweeping public health bill before the Assembly.
All right, only about 20 seconds left. We don't have time to get into Medicare Part D. I know you wanted to talk a little bit about that, but next time you come back and talk with us, we'll try and talk about that and see what's going on there. With all of these, it seems like there are issues that have a tremendous effect on people, and that most people will want these things to pass. So hopefully you'll be able to come back and give us good news about all of them.
Thank you, sir.
All right, good seeing you.
I appreciate it.
All right, always. That is Roger Manno, who is delegate from the 19th District. And if you know a newsmaker, we'd love to hear about them at cn8.tv. Thanks for watching Comcast Newsmakers. Till next time, I'm Tony Hill.